Hi, my name is Dr. Tom Rofrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida. And today I'm going to talk to you about why gluten-free diets don't work. So I've been practicing now for over 30 years. I've seen over 100,000 patient visits. And most of our patients are coming in with these chronic complaints of digestive issues, IBS, IBD, headaches, migraines, aches and pains, fatigue, anxiety, depression, skin issues, just brain fog, just a host of chronic complaints. I mean, we're talking even beyond that, but those are really the foundation, basic ones. And they've had them for years. I've been to this doctor, that doctor, tried gluten-free diets, not working. They might have felt better for a little while. So we do a lot of lab testing, and almost everyone, the majority of our patients, are gluten sensitive. So why would I say gluten-free diets don't work? Well, one reason is when you're sensitive to gluten, when you have these chronic issues, you're not only sensitive to gluten, but I found it's gluten, grains, yeast, sugar, soy, like a number of different foods that you're sensitive to. So just eliminating gluten out of your diet, you might feel good for a little while, but isn't going to really do the trick. So a while back, now over 10 years ago now, when I had personally a lot of these same health issues, IBS, aches and pains, fatigue, brain fog, just skin issues, just overall feeling miserable. I had autoimmune thyroid, Hashimoto's, rheumatoid antibodies were elevated. So again, aches and pains all over. So I was just feeling really miserable, and I found out I was gluten sensitive. So I went on and that runs in my family. So I went on a gluten-free diet. So like for breakfast, I would have gluten-free toast, like millet. There was millet in there, and yeast and other ingredients. Lunch, I would go to the Chinese restaurant next to my office at the time, and I would load up. I would have rice with vegetables, double serving of white rice, plenty of vegetables. Dinner, I would have gluten-free pasta or more rice or millet. I mean, I was feeling miserable. I might have felt a little bit, maybe mentally, because I was doing this, but I just continued to feel worse and worse and worse. I mean, it was not good. So what I started doing, so I realized, all right, well, what is going on here? So there was many other foods, it turns out, after testing, I was sensitive to as well. And when you are sensitive to gluten, really the best diet I found is not only eliminating gluten, but I call it the free diet because it's free of all the common allergens, those foods that are most commonly responsible for digestive and other chronic health issues. So for me, and also for hundreds or actually thousands of people I've put on this afterwards, I found it was gluten, grains, sugar, yeast, dairy, soy, legumes, corn. And when you start eliminating those, so when I started eliminating those and went to again, eliminating all the grains, sugar, yeast. So eating more of, it's like for lunch and dinner, it's the proteins, a lot of vegetables, meat, chicken, fish, a lot of vegetables, essential fats, and eliminating those common foods. Then I started to feel better. Digestive issues started clearing up, brain fog started lifting, skin started clearing up, and antibodies, thyroid antibodies, rheumatoid antibodies went down to normal, and that's when I really started healing. And since then, I've so many patients on this, and I found it to be really effective. So the other thing I found along the way, and by the way, if you want a copy of phase 1 of the free diet, we're going to put a link below, so feel free to click on that and get a copy of that. So the other thing that's interesting when people go on gluten-free diet is they start buying all these gluten-free products. You know, so patients come in and like with IBS, or and all these other symptoms, but they're like, yeah, well, what do you have for? I'm gluten-free, they say, and well, what do you eat for breakfast? Well, gluten-free bagels or gluten-free toast. And then what about lunch? Well, again, they'll have rice, gluten-free pasta. Dinner, same thing. They might have some protein with that, but they're eating starches, carbs, grains, snacks. What are you eating for snacks? Oh, gluten-free cookies, gluten-free cake, gluten-free brownies. Like, seriously, it's the grains, the sugar, the starches is what is really driving all that inflammation. It's not just the gluten itself. And a lot of people cross-react to these foods. Like, for instance, corn is a big one. So when you're on a gluten-free diet, if you're eating corn, like cornbread, for instance. I used to eat cornbread when I was going through this. I felt miserable. So it's really true. If you want to truly get your issues cleared up, what I found out is, again, it's not just gluten, it's gluten, grains, corn, sugar, yeast. So those are just revolving around gluten. Just those itself I would avoid. Definitely. And the gluten-free products. Oh, another example, I had a patient who had chronic migraines her whole life. She was in her late 50s by this point. And a lot of other things also associated with gluten. She was, after testing, she was gluten sensitive as well. She had the depression, the anxiety, the chronic pain, digestive issues, besides migraines, debilitating migraines. So anyway, we got her to a point between the free diet, the supplements, and treatment. She was completely better, and came in, called for an appointment, came in with a severe migraine, hadn't had one in quite a long time. So I'm like, well, what'd you eat? Have you had any gluten? Well, no, I haven't. Well, any new foods or snacks or anything? Well, I have been eating these gluten-free Rice Crisps. I'm like, oh, really? Well, what was the name of them? So I looked them up online. Sure enough, it says gluten-free. Great. It's a great marketing thing. No high fructose corn syrup, low cholesterol per serving, made with corn and whole grain brown rice. I'm like, all right, well, let me look at the ingredients. So brown rice flour, corn, let's see, whey, salt, maltodextrin, which is corn sugar, cheese, monosodium glutamate, MSG. There's MSG in these healthy gluten-free products. And you're wondering why you have a migraine. Oh my gosh. So just because it says a gluten-free product does not mean it's healthy or it's not going to mess you up. So just be aware of that. So there's gluten-free products per se can have a lot of these other things in them, often do. So if you're going to eat gluten-free, then just choose gluten-free foods that are naturally gluten-free, like vegetables, meat, chicken, fish, avocados, a lot of healthy fats, fruit. Those are all naturally free of gluten, but to go buy these gluten-free boxed packaged products, you can often run into trouble, like with the woman I just mentioned. And then lastly, another reason why gluten-free diets don't work. Well, a huge part of the issue is when you have chronic digestive or other health issues are pathogens, infections. So most of our patients, these issues have yeast, parasites, or bacterial overgrowth. So we do a lot of, including the lab testing, we do a lot of stool test kits that we send patients home with, and it checks for all these digestive markers and pathogen infections. Almost everyone comes back with either parasites, yeast overgrowth, bacterial overgrowth, or all three. So when you have these infections, these bugs growing in your system, just because you are avoiding gluten isn't going to get you better. Okay, so you really need to find out what's in there, and once that's done, then we can provide solutions to clear it up. Is it yeast overgrowth, and there's different things we can do to help clear that up, or bacterial overgrowth or parasites. So it's really, the bottom line, it comes down to honing in on what exactly is the root cause of your symptoms, and then being provided with long-term permanent solutions so that you can get better. So thanks for joining me this week. If you know anyone that would benefit from this, feel free to share it. If you'd like to subscribe to my YouTube channel so you can get notification of new videos, go ahead and do that. And and if you want a copy of the free diet again, you can just click the link on the bottom. So thanks again for joining me this week, and look forward to seeing you next time. Take care.